Welcome back to the Health Perspective. Today we're talking about preventative health checks. What are they? What are the benefits and drawbacks of having one? And I'm going to be sharing my personal viewpoint on how my attitudes to health checks have changed as I've become more experienced as a doctor. I'm your host, Dr. Daniel Gordon, and I do literally hundreds of health checks a year in my role as an experienced GP. So I'm using this channel to share that experience directly to save you time and energy from doing the research yourself. So let me begin by defining what I mean when I say a preventative health check or a health screening appointment. These are appointments that you undergo with your physician or doctor when you don't have any specific symptoms. And the goal of these appointments is to detect potential health issues at an earlier stage. Some people may do these kinds of health checks on a regular basis, for example, an annual basis, or some might do it as a one-off when they reach a certain age, which causes them to think more about their future health. And the kinds of tests that you would have in a preventative health check can be varied and include things like blood tests for diabetes, cholesterol, thyroid illness, liver disease, stool tests, for example, for blood, which can be a sign of bowel cancer, routine scans to look for early signs of cancer, and even simple body measurements like physical examinations and blood pressure checks. The thing is, if you have no symptoms and no particular reason to think something is wrong, most people will simply not routinely go for these checks. After all, if you feel fine, it's very easy to assume your body is healthy. But many serious conditions, such as cancer, diabetes, or heart disease, can simmer quietly for years before showing any outward signs. And so, the obvious advantage of preventative health checks is the opportunity to detect illnesses like these at an earlier, more treatable stage. For example, cancers that are caught before they've spread have a much higher survival rate. Similarly, discovering high cholesterol or high blood sugar early can allow you to adopt lifestyle changes or even start medications to reduce the risk of downstream effects. So, for example, heart disease or diabetes. And it's important for me to share my own experience from my practice, where I have seen patients come in for routine screening appointments and end up being diagnosed with something that needed urgent attention. And in these cases, the simple, proactive decision to come in for a check when they had no symptoms at all made the difference between catching that illness early and missing that window to diagnose when treatment could be most effective. You could almost say it was a life and death decision. So, from what we've said so far, it sounds like it's a no-brainer, right? Everyone should have health screening. Well, unfortunately, it's not so simple. There are some real downsides to screening, which revolve around the problem of false positives and incidental findings. What many people don't appreciate is that not all medical tests are perfectly accurate. In fact, no medical test is perfectly accurate, and some can produce what we call false positive results, meaning that the test suggests you have a problem when in fact you don't. And false positive results, of course, trigger investigations to rule out serious conditions. For example, repeat blood testing, scans, or even medical procedures like biopsies. And this can have significant ramifications for a person. It can cause anxiety, unnecessary costs, and sometimes even subject them to invasive follow-up procedures with their own risks of harm. Now, when I first started out as a GP and was exposed to the idea of screening, I tended to see these downsides as a major reason for people not to undertake health screening. I was super cautious, acknowledging that screening was valuable, but worried about the negative effect of over-testing my patients. Over time, however, and with experience, having done hundreds of these health checks myself, I believe that they are extremely important, and that if we employ thoughtful test selection and a personalized approach, we can mitigate a lot of the drawbacks and capitalize on those benefits. There's another important advantage, which we should mention here though, about preventative health checks, which people don't appreciate. And that's that they don't just spot diseases early, but they can also open a dialogue about your overall well-being with your doctor. When you have a prolonged screening appointment with your doctor, it gives you the opportunity to approach more difficult conversations about lifestyle issues. For example, addressing your weight, diet, or alcohol consumption in a way that feels proactive and less judgmental, instead of reactive when a problem shows up in later life related to those poor lifestyle habits. In my practice, I found that this can actually reduce shame around certain lifestyle habits and start meaningful conversations which help people make positive changes for the future. With my patients, I find in these appointments we can often broach difficult topics like mental health, alcohol consumption, smoking, or stress management, and that gives us a real early opportunity to intervene before things get out of hand. You might think that you're coming in getting a quick blood test, but ideally you leave with a broader sense about how your day-to-day habits and stresses are influencing your future health and risk of disease or illness. Meaning, ultimately, my view is that the drawbacks of screening, that is, overdiagnosis and the potential stress of false positive test results, can be managed with careful, expert handling by an experienced physician or doctor. So, if you're thinking of going for a health check, here are my tips. Firstly, choose a doctor or clinic with a solid grounding in preventative medicine. Second, make sure they know how to interpret results in a nuanced way and can draw the line between prudent further investigation and watchful waiting. And third, make sure that the appointment involves a discussion rather than just a blood test or a scan. It's crucial that you as a patient feel involved and informed and have time to explore relevant health issues which may be applicable to you. For example, if you have a strong family history of certain illnesses. Now, you can help me with my channel's health by commenting below on what topics you want me to discuss next time. And don't forget to upvote other comments you find interesting so I can take that information away and produce the kind of content that will be most helpful to you. Next week, we'll be discussing a mental health toolbox to support your mental health and well-being for the long term. Until next time, see you then.